Hi, my name is Dr. Dilip Mednani. I'm a board-certified and real self-verified facial plastic surgeon here in New York. And this is how to tell if you are an ideal candidate for a lower facelift. We will be looking at videos of patients interested in lower facelift to see if they can achieve ideal results. And we'll share what you need to know if you're interested in having this procedure. Let's get started. A lower facelift addresses the lower part of the face. So the face is split up into three parts. One is the upper face from the forehead to the eyes, the mid face, which is from the eyes to the top of the cheeks, and the lower face, which is basically the cheek to the jawline, but in facelift surgery it also includes up to the voice box. So lower facelift addresses everywhere from the cheek to the voice box to define the jawline and contour the neck. So in the old days, we used to address the upper face, mid face, and the lower face at the same time, and that's when a lot of people walked around looking done or looking overfilled or looking overpulled. And then as we've come to realize over time that it's basically the lower face that tends to sag in most patients, and addressing just the lower face by itself leads to a more natural result. So surgically, it's basically a two-part procedure. It's tightening the muscles underneath the skin and then tightening the skin. And this is where the variety of facelift procedures will vary from surgeon to surgeon. But basically, it's a two-part procedure. We elevate the skin, we redrape the skin, we elevate the underlying muscles, and we redrape the underlying muscles. A lower facelift will address the upper neck. However, if you have strong banding or deep banding, those 11 lines in your neck, that's best addressed with a neck lift. Or if you have a lot of fat or soft tissue above or below the muscles in the neck, that's also better addressed with a neck lift as well. So I'd say about 90% of the time when I perform a lower facelift, I am performing a neck lift as well. So let's look at some videos.
Hi, my name is Maria, and I live in Long Island, and I am 56 years old. I'm interested in having a lower facelift due to the asymmetrical nature of my face. So this side, my right side, is all puffy. I have a huge, laugh line and, the definition here under the chin. So I really want to get the fold lines, more definition on my fold lines, and definitely a lift on the neck. So the procedures I tried in the past was Cabela for the neck, and it was too painful for me, and I just really didn't see immediate results. I would like to know from the doctor regarding a lower facelift, how he would actually go about correcting the issue, especially with the lower end of my face. Does he have to cut it? Where does he have to cut it? What's the recovery time? What is it going to look like to heal? Am I going to have to be, indisposed? And will it last? And, how soon will I see the results?
So Maria is the perfect candidate for what we do, which for her, I would suggest a lower face and neck lift. And on further exam of all the pictures that we looked at, she'd be a great candidate for laser skin resurfacing and perhaps a little volumizing with a facial fat transfer. Marie mentioned that she has a facial asymmetry, or one side of her face was a little more quote unquote saggy than the other side of the face. And that's typical with most people. Our faces are siblings, they're not twins, the two sides. So one side is always a little, whether the cheek is more contoured or the jawline is sharper, and all that redrapes the skin on one side more than the other. What we do find is patients, as we age, the asymmetries in our face become more exaggerated as the skin kind of becomes more lax and loose. But when we pick everything up, the asymmetry tends to appear much less as we've removed all that excess skin. Marie asked where the incisions were going to be placed, and the incisions are placed around the natural lines of the ear. It's usually up here in the hairline, behind the tragus or the ear cartilage, around the lines of the earlobe, behind the ear and back here. For the neck lift, it's a small incision under the chin, so there's no cutting on the face per se. So through those incisions, we elevate the skin, we tighten muscles, and we remove all the extra skin, and we put everything back together. In terms of recovery, Maria asked for recovery. It's about 10 to 14 days for initial recovery. So we tell our patients you're restaurant ready in 10 to 14 days. So if you go out to a restaurant, really by that time, no one should be coming up to you and say, oh my God, are you okay? But a little scarf and a little makeup will cover most of the bruising by that time. And full recovery will take months. So final results are about 4 to 6 months after the procedure. There are things patients can do to prolong or maintain the results, and those are things that include avoiding the sun, don't smoke, keep your weight where it's at, and using good skincare. We tell our patients typically about 8 or 10 years later, patients come back for tweaks or touch-ups. Maria was concerned about pain. So most of our patients take pain medication for the first 24 to 48 hours. After that, they switch to Tylenol. Everyone's pain thresholds are different, but that's in general. We give our patients pain medication for 2 or 3 days, and most of them take it just for the first night. Typically, as with most patients, Maria had tried some non-invasive procedures. She tried a procedure called Kybella. Now that's different because Kybella is good for submental fat or fat in the neck area. When I look at Maria, I don't really see too much fat in her face. What I do see is a lot of lower face and neck skin laxity or looseness. So the Kybella is probably not the ideal non-invasive procedure for her. Maybe something non-invasive for skin tightening, whether it's all therapy or whether it's microneedling RF or different energy-based procedures out there, maybe something, or even like threading. Thread lifts are also an option for her.
Hi, I'm Lee. I'm 53 years old, and I'm from Los Angeles, California. The procedure I'm interested in is a lower facelift. The lower facelift would focus on my excess skin under my chin, which, whether I'm losing weight or gaining weight, continues to tend to sag. And especially on my profiles, it tends to sag quite a bit. The questions that I would have for the doctor is just really, what's the recovery time? I do have high blood pressure, and I am, overweight. So procedure, if it requires anesthesia, I'd like to know exactly how those conditions would impact me under anesthesia. What is the complexity of the surgery itself? Is it simple? Is it pretty standard? Or does it require, a lot of preparation? And those things, I think, are probably my main concerns. So I do want to know if I'm a good candidate for a lower facelift.
I think Lee is a great patient to discuss. I think he's more concerned with his neck area. So I would have to redirect him with a couple questions. Number one, he's a great candidate for a neck lift. The lower facelift can be performed at the same time, as that would contour his jawline. But for him, we would discuss neck lift or neck contouring options, as that seems to be his area of focus. The second thing I want to discuss with Lee is he mentioned that he's overweight at this time. I would like to ask him if he's planning on losing weight. If he's going to be losing more than 20, 30 pounds, then let's wait till after he's lost that weight. It'll be easier for me to do the surgery, and it'll be easier on his recovery. He'll probably get better results as well. In terms of his having hypertension, I'm not too concerned about that because I can perform this procedure under local anesthesia or even under IV sedation where we get a medical clearance. As long as his primary care doctor or cardiologist says it's okay to do the procedure, we're okay to do the procedure. And in terms of complexity, all surgery is complex. Right? I don't think there's any sort of quote unquote simple surgery, especially having surgery performed on your face. So with respect to the complexity, the skin has to be elevated. For Lee, we'd probably do some liposuction as well. He's probably got some fat deep to his neck muscles too that we want to take out. So we'd have to have a conversation with Lee as to exactly what he means by just focusing on the lower face, because he really needs his neck lift performed, and he may need a lower face lift, but I would have to discuss with them as to the nuances between those two procedures.
My name is Sheila. I'm 72 years old and I live in New York City. The procedure I'm most interested in having done is a lower facelift. I have jowls at the bottom of my face and I'd like to tighten them up. I think what I'm most interested in is having less of a fatty type look at my lower jaw. I feel that what is there right now is pretty smooth, but it also seems to add a kind of dimension to my face that I never really saw before. I think when you're younger, the bone structure holds up the facial muscles better. But now as I've gotten older, it seems, and this is the way most of the women in my family have aged, that the skin begins to sag. So I'd like to see it sort of uplifted just a little bit, and not so much to the extent that it's really tight, but just is a little less than what is there right now. The questions that I would have for a doctor, of course, is whether this could be done inpatient and outpatient, and I'd be most interested in the recovery time. I would also be interested in knowing whether there are any anticipated side effects that I may need to know about that would weigh into my ultimate decision. Most importantly, I think, in talking to a doctor is that I would want to know whether I am a good candidate for this procedure.
Sheila is a wonderful candidate for a lower facelift. She had a lot of laxity in her neck area, and on close look, she had a lot of lower face laxity in the jawline. So the lower facelift would pick up everything from the cheek to the upper neck, and the neck lift would soften the neck banding in the middle of her neck there. She didn't mention any medical or health problems, so that's wonderful. She's checked off that box. In terms of, she asked whether it's outpatient, inpatient. For example, in my office, all our facelifts are outpatient, so you go home the same day, you come back and see us the next day. Sheila asked about recovery time. Recovery is about 10 to 14 days, where you are swollen, bruised, lumpy, bumpy. Sheila asked about risks or potential complications. So there's 4 main risks with every surgery. It's bleeding, infection, scarring, and nerve damage. Bleeding risks are minimized by having my patients take it easy after surgery. So there's no exercising, heavy lifting, or bending over after surgery. And you avoid any blood thinners such as aspirin, Motrin, Advil, or any kind of vitamins or supplements such as fish oil or omega-3s. There's a chance of infection afterwards, so all our patients are placed on antibiotics, and we monitor you closely afterwards if you were to develop an infection. Scarring and nerve damage are very rare. Nerve damage is where it can range from you can't feel parts of the ear or you can't move the side of your face. Once again, as a facial plastic surgeon, this is all I do for a living, so our risk profiles are very low, but your surgeon has to know where their nerves are. And in terms of scarring, that's also part of your post-op care. We keep a close eye on you, and we have lasers and injectables that can be performed to help improve or minimize the scarring afterwards. I think it's important for patients to do their homework. We have wonderful resources such as Real Self. Find surgeons that do a lot of the procedure you're looking for. If your surgeon is just doing 1 or 2 of these a year, it's probably not the right surgeon for you. Make sure you click with your surgeon. You don't have to be best friends with your surgeon, but just make sure you have a good rapport with them. Make sure you can connect with them afterwards or connect with their office with them afterwards, God forbid there's a problem. And really do look at your surgeon's before and after pictures, because you will start to see a trend between the surgeon and their before and afters. It's an art. we're all working with the same palette. We're all working with the same paints, but you'll see the outcomes are a little different. And that's where the patient has to kind of come to terms with what they're going to get. How do patients feel after surgery? For me, that's really the most important part. For me to see my patients walk in after surgery, smiling, walking a little taller, dressing a little nicer, just feeling more confident about themselves is amazing. Even though we've done a little tweak in their jawline, a little tweak in their neck, but how they perceive themselves is really a wonderful result after surgery. All I did was reveal what was already there, and we bring them back to how they used to look, and patients just feel more, or they feel like they look more on the outside, how they feel on the inside. Are you interested in a lower facelift? Find out all you need to know at realself.com.